Good morning. I'm Stephen Bailey from San Antonio. On behalf of the Society for Cardiac Angiography and Intervention, I have the great fortune today to introduce Dr. Amelia Young from UCLA, this year's winner of the Gregory Braden Award, an award that recognizes and is provided to the individual that we've identified within the SCAI as the best interventional fellow in the United States in 2013. So Dr. Young, welcome and congratulations.
Thank you so much, Dr. Bailey. It's my pleasure to be here.
So I'm not sure you know a lot about Dr. Braden, so if I could, let me take a minute and just tell you why this award was made and what it represents. Greg Braden was one of the early pioneers of interventional cardiology. When we were first beginning to learn about percutaneous interventions and assessing those, intravascular ultrasound, atherectomy, Greg was an individual who not only helped develop those, but more importantly was a mentor for a lot of individuals learning how to do that. And in fact, one of the most satisfying features of his practice was having somebody come to his lab and spend time with him and learning. Now, this was before we even had interventional fellowships. Greg unfortunately passed away at a relatively young age due to complications of surgery because of all the procedures he did. And as a result of that, his legacy is to honor an interventional fellow that's been picked from a rigorous process and from applicants from all of the fellowships in the United States. And so your honor is to represent that mentorship, that legacy of investigation. And so it truly is an honor to have you be the individual this year. Perhaps you might tell us a little bit about you. And what you do and what you're looking forward to do as you finish your fellowship.
Yes. Thank you so much for sharing that wonderful story of Dr. Gregory Braden. He's truly an inspiration to all of us and to myself. I am currently an interventional cardiology fellow at UCLA, and I plan to do a second interventional year in structural heart disease with Dr. Ted Feldman starting July of this year.
Outstanding. So not only are you interested in what has been how we arrived at interventional with coronary and revascularization, but now want to move into what has become the new era with Dr. Feldman, who's been such an inspiration for all of us as well, and spend your time learning about valvular and structural disease.
Correct.
So I know that Dr. Tobis was your mentor, and in fact he's the one who was the person who submitted your name as an applicant, and we're excited he did that. Tell me a little bit about that relationship.
Yes, Dr. Tobis is my wonderful and outstanding program director and mentor at UCLA. And not only did he nominate me for this award, but he has been a true inspiration to me. He continues to help me learn to be a good interventionalist in the cath lab, and he is very methodical, very detail-oriented, and through that I have learned many techniques and technologies through him, and he continues to inspire me on a daily basis.
Well, that's wonderful. Greg and John were contemporaries. They did work in similar areas, ultrasound, IVUS, and other things. Tell me a little bit about the research that you've been doing during your fellowship.
Yes, in the past year I've worked with Dr. Tobis on a peer review article looking into the use of mechanical support in high-risk, complex coronary interventions, and whether there's a significant benefit as to using intra-aortic balloon pump versus percutaneous ventricular assist devices.
And your conclusions from that?
So the conclusions right now are a little wishy-washy, but I think that there is always a place in using intra-aortic balloon pumps, and there's always a place in using more vigorous support devices, such as the Impella device.
Well, that certainly clinically challenges us all, doesn't it? Trying to decide which device for which patient at the right time for the right problem. But It's good that you've had a chance to think about that critically. I know that's going to serve you well when you move to Chicago and work for Dr. Feldman. Is there an area in the structural heart arena that you find most fascinating, or that you think that you're going to be involved in terms of research?
I'm very fascinated with all kinds of structural heart diseases, but in particular, perhaps the aortic valve replacement has been one of my most interesting aspects, and I hope to focus my area of research on that. Also, the mitral valve therapies have also been fascinating to me as well.
Well, there would be few places that would offer you as many opportunities as Dr. Feldman
Correct.
with his involvement in both of those areas. So I think it's a great opportunity for you. And I know that you're going to have had mentorship now from Dr. Tobis, Dr. Feldman, and hopefully you'll feel like the society itself, because that is what the society is about,
Absolutely.
is helping our interventional colleagues be the best of the best. That's what this meeting is about.
Right.
Congratulations again.
Thank you. Thank you so much.
Okay.